Hi everyone, my name is Dr. Mansi Jani. I am an international board certified lactation consultant working with Apollo Hospitals, Navi Mumbai. I am very pleased to talk to you today on this occasion of World Breastfeeding Week 2021. This year's theme is Protect Breastfeeding, a Shared Responsibility. And in today's session, I will be talking about the same and how we can take some steps and help a new mother reach towards her goal of successfully breastfeeding her baby. This is how we will be able to protect, promote, and support breastfeeding. We are all aware that breastfeeding and breast milk is the optimal nutrition, the gold standard of nutrition for a newborn baby. World Health Organization recommends exclusive breastfeeding for the first 6 months of life for a newborn baby and continued breastfeeding till 2 years or beyond, along with adding some complementary food for the baby. So there are certain challenges reaching towards this goal of exclusively breastfeeding for 6 months and then continue till 2 years. Challenges some others face in the form of milk supply related issues, baby latching issues, nighttime feeding difficulties, taking care of a preterm baby or taking care of twin babies, or painful breastfeeding sessions, or breast related complications related to lactation. So these certain issues which come up, and this raises a lot of concerns and worries for the parents of how they will be able to feed their baby. So now I will be discussing about few steps, certain steps which can be taken, which can be followed, which will help you to easily breastfeed your baby or reach towards your successful breastfeeding sessions, and it would reduce your queries and your concerns or your worries about the same. Your first step you can take is antenatally in your pregnancy period. You can get in touch with a lactation consultant, understand the get some information and understand about breastfeeding, what and how you're supposed to do it. What are the things that you should know once you're going to be delivering, you're going to be breastfeeding your baby. So you ask your gynecologist to refer you to a lactation consultant antenatally when you're in your 8th month or your last month, your last trimester of your pregnancy. This would really help you to gain all the information which is required so that you can be prepped up for the next phase of the after the birth which will be coming in. Your second step towards easy breastfeeding session is to initiate the breastfeeding in the first hour of birth. Soon as baby arrives, if it is difficult to latch the baby immediately, maybe you can take a couple of hours and then start breastfeeding. So this step is very important. Babies in the early stage, in the just first 2 hours of birth, to initiate breastfeeding and to get in skin to skin touch with baby. Avoid any form of formula milks or honey or glucose water to the baby. We should first start with breastfeeding in the early stages, which is initially after birth. This is your important second step. Your third step is when you are admitted in the hospital, when you have delivered your baby, get in touch with your in-hospital lactation consultant to get practical assistance and practical guidelines about how to position your baby, how to latch the baby onto the breast. Certain information about what are the feeding related signals baby shows, what are the feeding signals after the breastfeeding once baby is full, how to understand if you're adequately producing milk, if baby is adequately receiving the milk, if baby is getting enough. So these questions are very important at that phase when you're in the hospital. So you should get some practical assistance. This is your step 3, and understand while you're in the hospital. This would really help you once you're going home after the discharge. So the third step is also very important. Your fourth step comes is to, while you're breastfeeding, you should avoid introducing any artificial nipples or bottle feedings or pacifiers to the baby. These artificial things, they divert the baby away from the breastfeeding. And then later on, it becomes very difficult to bring the baby back to the breast. So the fourth step you should remember is to avoid the artificial feeding methods like bottles or artificial nipples or teats. This was your fourth step. Your fifth step is to get in close contact with baby, like frequently spending time, maybe frequent skin to skin contact. This is how your baby would also be more understanding or more into the breastfeeding sessions, and baby would also be easily able to latch onto you. You would be able to produce a very good milk supply. This is your fifth step. Your sixth step is to learn the techniques of milk expression for some situations, sometimes it may arise if mother and baby are not together, if baby has been transferred to another setup for another care or ICU setup. So then milk expression techniques are something which will really help you to provide your own milk to your baby. So you can get in touch with your lactation consultant to explain the storage and the handling guidelines of in what temperatures you can store, how you can handle the milk, and how it can be safely given to the baby if baby is not there with you, or if the breastfeeding is temporarily interrupted. So that is your step. Your next step would be to I'm just trying to place importance on parent, the family support, and partner support. So, as a shared responsibility, as a theme of this year, it is very important that mother is having new mother, she's having family and her partner support. Maybe in the form of burping a baby after the feeds, or changing diapers, or helping her to put baby to sleep, or just helping her in positioning the baby onto the breast. This is also very important. These little things or little help would really go a long way in reaching towards her goal of easily breastfeeding her baby. This would be your next step. Then comes your eighth step, is for you to understand when you will be going home after your hospital part, after once you are getting discharged. During your discharge, to understand the proper discharge plan, to understand what are the home care related guidelines you should know, some red flags, some techniques where what you're supposed to do if baby is not fed well, or what you're supposed to do when you will understand that baby is getting adequate, when baby is not getting adequate. So that your discharge plan is something which you should be aware of while you're getting discharged from the hospital. That is important. So get in touch with your pediatrician and your lactation consultant to get that discharge plan in place. Your next step, step 9th, is a very important step. This is the post-discharge follow-up. So once you're going home, the situations would change. In hospital situation is different, at home situation is different. You will be handling baby care, feeding related, everything will be happening without our supervision. So it is very important that you come back for follow-ups on the scheduled time, the scheduled meets with your pediatrician and your lactation consultant. So even if there are any residual concerns, any residual issues in breastfeeding once you're at home, you can come back and you can easily take those up with your doctors, with your LC, and those can be solved in the very early stages. So this is very important that you get into the post follow-up part with your pediatric and your lactation consultant. The last step, step 10, I would like to emphasize on getting together or getting in touch with another mother who has breastfed her baby or who is in the similar journey. This would really help you to understand how were her concerns and how she handled, or maybe you can give the tips about how you face certain challenges and how then you are coming out of it. So these things are very empowering. It will really help you. It will really help out other mothers. So this is how we can, as a community, together, because it is a shared responsibility being the theme of this year. This is how we will be able to protect breastfeeding worldwide, to support and to promote breastfeeding. So again, thank you so much for watching, and bye.